My father was posted frequently and often, so I lived all across Canada in the United States. In 1955, he was found to have what was known then as a peptic ulcer, and he had surgery, and although the surgeon didn't tell him, he actually had cancer of the stomach. I decided that there had to be a better way of conveying bad news to patients than the one that this surgeon had used, and the only way to do that was to go into medicine myself. My mother said, "Oh no, you should be a nurse." And all my teachers said, "Oh, you couldn't possibly be a doctor." And that just made my resolve stronger. My entire time in medical school, I worked in the lab of another chemist who was transitioning into becoming a pharmacologist, and I loved that work. So after I finished the internship, my husband and I got married, and we went to Stanford and both did research postdoctoral fellowships there. And then he got a job at Dalhousie, and I finished my residency training here.
She was very important in making the link between clinical pharmacology and medicine, and really demonstrating the value of translational research.
But I became very concerned that physicians and other individuals who had responsibility for patient care were making decisions about prescribing based on either drug advertising or less than satisfactory information.
She worked hand in hand with members of our Department of Pharmacology at Dalhousie, and was a great clinician, a great detective, a great researcher, and a very strong leader in this field.
We created a newsletter called Drugs and Therapeutics for Maritime Practitioners, which we produce 6 times a year, which basically was an evidence-based, very easy to read piece of information. And we did that for 25 years.
I can remember many journal clubs at Jean's house where she would work with students and tease apart some of the complexities around clinical therapeutics, and really helped make us better people and better physicians as a result.
I got invited to sit on the editorial panel of a national book which was known then as the CPS, or Compendium of Pharmaceutical Sciences, which was published by the Canadian Pharmacists Association. I suggested to CPHA that they needed to make a companion volume, and that evolved into a book called Therapeutic Choices.
I went through 5 editions with her as the editor, and nowadays continues on as an electronic textbook, a guide for pharmacists and primary care physicians who need to make choices among drugs every day.
They can just open up the book on the desktop and get everything they need in about 30 seconds in order to write the prescription. The Health Council of Canada recommended that it be in every physician's office in the country.
Well, Jean has been a tremendous advocate for the wise use of medications in clinical practice, and she's done this through education involving medical students, residents, and physicians in community practice.
She implemented the academic detailing program for physicians, which is going on now and is still looked at around the world as an exemplary program.
When the Canadian Institutes for Health Research was set up, one of the institutes that was created was the Institute of Gender and Health. And I was approached to chair the Institute Advisory Board, and that was an amazing experience.
She has chaired, countless local, provincial, national, and international committees.
I've had the opportunity to be president of a large American organization, multiple Canadian organizations.
We all aspired to be the clinician that Jean Grey was. She was a wonderful role model and mentor. Everybody wanted to be Jean Grey.
I've been blessed both with my family, 2 wonderful daughters, and also with my professional career.
Canadian Medical Hall of Fame laureate, Dr. Jean Grey.